This conference will now be recorded.
Okay, so hi everyone. Good morning or good afternoon or good evening, wherever you are from the world. My name is Dr. Bhavna Sharma. I work as an endocrinology registrar in NHS London, and I'm a part of the Teachio team. This is going to be a session on OET tenses in context of writing as to what tenses are supposed to be used at different points on a OET letter. Now, this is done in my way or the Teachio way. What I've tried to do is rather than overcomplicate things and mention things which you're not really interested in and they're just going to make your life difficult. So rather than telling you about this type of tense and that type of tense and what is that particular tense called, what I've done is I've made this extremely easy for everyone, and I try to do a cheat sheet sort of a thing. So I'll be going through different points on the OET letter, and I'll just point out what tense we're using and how we're using it and why we're using it on different points on a OET letter. So I understand that when we are attempting the OET exam, we're not really English teachers and we're not really English graduates. We're doctors, we're nurses. We do clinical things in our daily life. Maybe we may not have the best English, but we know our jobs and we know how to take a history, we know how to do an examination, and we should know how to make a diagnosis. Okay, because that all is very familiar to you, if we try and explain OET writing in medical terms and we try and explain it as to how we would do a standard presentation of a history, it becomes extremely easy for doctors and nurses and any other medical professionals attempting the OET. One thing that really disappoints me when people are teaching on OET, they try to go into very, very much details about what past perfect tense is, what present perfect tense is, what's continuous tense. And this is basically being conducted by people who aren't medically trained. So when they use that type of language, it scares a lot of doctors and nurses. And then they start thinking, oh my God, I can't really do OET because it's too complicated. No, it's not. We're just going to dumb it down today. And hopefully after this session, we're not going to be making mistakes on OET writing, especially tenses. Guys, if you can hear me and see me as well, then please type into the chat window. Okay, that's excellent. Okay, now one more thing that I just want to mention before we start this session, guys, you're not expected to be literature experts when you're attempting the OET writing. So trying to use fancy words or fancy sentences is not going to increase your score. I often find students, they use a lot of very complicated language and a very complicated sort of sentence structure when they're attempting the OET writing. Remember, the OET writing has got two parts. One is that you're supposed to write proper grammar. I mean, accurate grammar, not necessarily the best grammar. And the second part is that you're supposed to select the information from the case notes, try and organize that information from the case notes, and make sure that you're not including any irrelevant information on your OET writing. If you make the first part easy, so if you make the part when you're thinking about grammar easy, then you're going to leave more time for yourself to be able to select information on your case notes, which is actually the more difficult thing. So Now that we've dumbed down tenses, we're going to dumb down our sentences as well. We're going to make them easy for us. We're not going to overcomplicate things. And because we're making it easy for us, it's going to be easier for us to have the right tenses and at each point and not make silly grammar or silly spelling mistakes which make us fail. So using complicated language isn't going to make you pass, but making stupid mistakes on your tenses and making stupid mistakes on your spellings is going to make you fail. So I want you to pass. So we're going to make our life easy and we'll try and figure out how do we pass. Okay. All right. Now I'm going to go from section to section. So I'm going to go from what tenses to use on an introduction when you're introducing the letter, and then we'll move on to examination, and then we'll go on to conclusion. Okay. All right. So introduction, when you're introducing yourself to your patient. Okay. So when you're introducing yourself to or you're introducing your patient to your audience, the introduction is happening when you're writing the letter. So when at the point where you're writing the letter, the introduction is happening. So the tense that we have to use is a present tense. Okay. So you're going to tell your audience, thank you for seeing. So seeing, so that's present. So thank you for seeing Mr. George Nada Fortune, a 46-year-old gentleman. Now, this might be a transfer letter, this might be a referral letter, this might be a discharge letter. Okay. But at the point where you're writing the letter, the transfer is happening. So the transfer is in the present. So what tense are you going to use? Simple. You're going to use the present tense. Okay. He is being transferred. Now you can modify that depending upon the type of your letter. He is being referred. He is being discharged. Okay. Notice the things which are in bold. So thank you for seeing, present tense, because it's the transfer is happening while we're writing the letter. So present tense is everywhere. Thank you for seeing Mr. George Nada Fortune. He is being transferred to your care. Okay. That's it. On your introduction, everything is going to be in the present tense. All right. Guys, if you've understood this and what I'm trying to emphasize on this session, please type in yes, and then we'll move on to the next. If you are confused, try to make notes during this session. So just try and write down. So grab a pen and a paper, and we're going to be making notes while we're talking, okay? So introduction, present tense, okay? Excellent. Moving on, provisional diagnosis, okay? Now, when you're writing the letter, the provisional diagnosis exists, okay? The provisional diagnosis is true. And if it is true, what tense are we going to use? We're going to use the present tense, okay? Mr. Fortune has signs and symptoms suggestive of probable cauda equina or spinal cord compression, which I'm going to stop there because that's another thing that we're going to be talking about. But notice that when we're talking about a provisional diagnosis, because the diagnosis exists at the time when you're writing the letter, that's why it's in the present tense. Remember, the expert or the specialist might look at that diagnosis and they might think that you're wrong, okay? But for you, when you're writing the letter to your audience, you think that this diagnosis is true, okay? And it exists. So that's why you're going to be using the present tense. Now, the second part of the sentence is a little bit more complicated. Notice what we've written. We've written which would benefit greatly from your assessment and further care. Okay. So just writing, remember when you're writing the letter, the benefit has not happened yet. Okay. So what we would write is which would benefit. So the benefit might happen in the future. Okay. So how are you going to write it? You're going to write it by which would benefit greatly from your assessment and further care. Okay. Mr. Fortune might have symptoms. So notice that this is a better way of writing about a provisional diagnosis. So you're going to write might have. Okay, it's still in the present, but there's a might attached to it because you're not too sure. Okay. Now, very good, Diksha, that you've asked this question. Any form of present tense can be used in introductory part. Diksha and everyone, this is something which extremely makes me disappointed about the way that OET is being taught. Don't confuse yourself by thinking about what form of present tense am I going to be use. Am I going to be using the present continuous? Am I going to be using the present perfect? Make your life easy, guys. Don't confuse yourself. Just use the sentences that we're giving you. Use the tenses that we're giving you, and that's it. Don't worry about anything else. Make your life easy on your OET writing. All right. Ashwarya has asked how to write if a diagnosis is not mentioned in the notes. So Ashwarya, remember the OET is an English exam essentially. It's not a medical exam. If you don't know the diagnosis, make a diagnosis. If your diagnosis is wrong, then they don't care, okay? If you think that the patient might have appendicitis, then you write that. If they're telling that, okay, they've got abdominal pain, which is in the right iliac fossa, and you think that medically, yeah, this might be appendicitis, even though they haven't given you a diagnosis of appendicitis, you can write that. If you're not too sure what the diagnosis is, you've gone through the case notes and medically you're not able to solve what the provisional diagnosis might be, let me just give you an example. If it's a patient who has chronic back pain, but you don't really know what the back pain is, and now you're referring your patient to a neurosurgeon, okay, but you don't know what the diagnosis is, then you might modify that sentence and write Mr. Fortune has symptoms of intractable back pain, which would benefit greatly from your assessment and further care. Or Mr. Fortune has symptoms, not suggestive of, so we'll cut the suggestive. Mr. Fortune has symptoms of recurrent back pain, which would benefit from your assessment and further care. So what are we doing here, Ashwarya, is that we're cutting out the signs, okay, and you're cutting out the and. You're just writing about the symptoms that the patient has and the symptoms which are making you refer the patient to a specialist. Okay, so Ashwarya, if you've understood that, just type in yes. And Diksha, if you still want to find out each and every tense in detail, which I've already warned you about doing because you're just confusing yourself and making your life difficult, you can still go to our YouTube channel, which is by the name of Teachio Academy, and this has been covered in detail. But for everyone else, guys, you want to just pass this exam. You don't want to become a literature expert or a language expert. If you're failing consistently and you're not sure why you're failing, life can become very easy by dumbing down OET writing, especially the grammar part, because you're going to have to spend a lot of energy on content and clarity. And if you get stuck in grammar, you won't be able to do the second part. So if you are failing and you're not too sure why, make your life easy. I shouldn't say that. Copy these sentences, copy the tenses, and use them on your future practice. Okay. I don't want people to get caught into these things which, I mean, if you are someone, okay, you're scoring B plus and you want to score a A, then by all means go to that stage. But if you are someone who's scoring below C or C, you want to pass your OET writing fast, just use the sentences and use the tenses that I'm giving you. Okay. Yes, Jasimran, you can write that. That's fine. There's no set rule as to what sentences. Okay, this also happens a lot. When academies are teaching you about OET writing, they'll tell you, oh, use this sentence and you'll score better marks. Don't use that sentence. That's going to make you score worse marks. As long as it's grammatically correct and polite, you can use any type of word structure. Okay. So Jasimran has made a modification. So he said, can we write, Mr. Fortune has signs and symptoms of probable spinal cord compression, which would benefit greatly from your evaluation and further management. So that's also a very good sentence. Okay. Excellent. So that was about provisional diagnosis and how we're going to write about provisional diagnosis. Now, when you're talking about history of presenting complaints, now the patient will come in with one complaint. So they'll have, for example, they'll have a history of back pain, and then you're going to describe the back pain. So like you take a history, there's a presenting complaint. So Mr. Fortune has symptoms of intractable back pain since 2 years. Okay, so that's going to be your presenting complaint. Everyone knows this. All doctors and nurses know this, how to do this. Then when you're presenting your case to your examiner, or you're presenting your case to the specialist, you're going to talk about the history of the presenting complaint. Now, the presenting complaint exists when you're writing the letter. Okay. But the history of presenting complaints is a history. So it's happened in the past. So now we're going to flip from the present tense, which we used in our introduction, to the past tense. Okay. So how are you going to write that? Mr. Fortune first presented on, so notice the tense which is being used, it's a past tense. So Mr. Fortune, simple past tense, Mr. Fortune first presented on whatever date they came to you with complaints of severe back pain, which started, again past tense, while he was, okay, that's also in the past tense. He described the pain. So this can be describes as well, but what I like is I like the paragraphs to be in one tense. Okay, so when the patient came to you, he had a complaint of this, and then he had a description for the pain. So the description was in the past, so you're going to be using the past tense. So he described the pain as and stated. So the fact that he stated something also happened in the past. So again, we're using the past tense. He stated that the pain radiated down to his. So the radiation of the pain is also historical because you're describing the history. It's again past tense. And he stated his pain was aggravated by and relieved by. Okay. So when we're talking about a past visit that the patient has come to you with, everything is going to be in the past tense. Okay. Now I'm going to modify this a little bit. When you're talking about the last visit that your patient came to you with, I'm going to talk about the examination in the next few slides. So I'm going to skip that for now. But when you're talking about the last visit for a patient, you're going to be writing, Mr. Fortune was seen in clinic. Okay, was seen in clinic urgently today with new onset of, he was febrile and had loss of anal tone. Okay, so a good way to write about the last visit that the patient comes to you with is was seen in clinic. But notice that because we're talking about history of presenting complaints, we're going to be talking in past tense. Okay, so presenting complaint exists when you're writing the letter. So that's going to be in present tense. History of presenting complaints is a history, so it's happened in the past. So that's why we're going to be using the past tense. Guys, if you've understood the difference and you've understood why we've used the present tense for the presenting complaints, so make your life easy. Presenting complaints, so present tense. History of presenting complaints, because it's a history, it's going to be in the past tense. Just type in yes if you've understood this. Okay, excellent. Now, when you're talking about a hospital admission, the hospital admission also happened in the past. So we're using the past tense. Guys, if you're confused about why we're using was admitted and why we're not using admitted, then this is active and passive voice. This was covered by Manoj sir in a previous session. So if you go to our YouTube channel, you should be able to get that question answered. But this is just a cheat sheet. So if you're talking about an admission for into a hospital, then was admitted and was brought are two ways that you can write this. So Joycelyn, so when somebody has complaints of something, for example, if Mr. Jones has complaints of back pain, when you're writing your letter, then that complaint is still ongoing. Okay, that means the complaint is still happening. Your patient is still complaining of that thing. So that's why we're going to be using a present tense. All right, when this patient's pain is being described, you're going to be starting with the history of presenting complaints. So you're going to be writing about when the pain started, what was the pain described as, what medications did the patient try. So that's why all of it was in the past tense. Okay, right. So again, when you're talking about hospital admission, the hospital admission happened in the past. That's why we're all going to be using the past tense. Okay. When we're talking about test results, examination, and vital signs, now this is the most common mistakes that students make on their OET writing. Guys, when we're talking about somebody's test results, the test results happened in the past. So you're writing the letter now, and the patient has already had the investigations, and those investigations have happened in the past, and the results have come out in the past. Okay, when you're writing the letter, the investigations have already happened and the results have already come out. So that's why in that case, everything is going to be written in the past tense. Okay, so his bloods revealed a low hemoglobin. Okay, now you've seen your patient for a long period of time, or you've seen your patient for this visit. You've done the examination. The examination has happened in the past. When you're writing the letter, you've already done that examination. So that's why the examination is also going to be in the past tense. Okay. Vital signs. Vital signs, when you're writing the letter, the vital signs have already been taken and you've already got a result from the nurse or the doctor taking the vital signs, and therefore it is also in the past. So you're going to be using the past tense. His blood pressure was low and his pulse was feeble. Okay. Guys, if you've understood everything till now, please type in yes, and then we'll move on to the next part. Yes, just Simran, that's also fine. But notice the tense that you're using. The tense that you're using is the past tense. Okay. All right. Okay. Social history and lifestyle. When you're writing the letter, the social history and the lifestyle is still being followed by the patient. Okay. At the time of writing your letter, the patient is still doing those things. Okay. Notice the tense that I've used. I've used the present continuous tense. Okay. So Mr. Jackson is still smoking. Mr. Thomas is currently homeless. Okay. So the smoking is still happening. So that's why it's the present tense. He is doing the thing still. Okay. Very important to pay attention to the sentence I'm using. It's going to make your life very, very easy. So Miss Jackson is still smoking. The patient is still doing this in their lifestyle. Okay, so that's why present continuous, because the thing is still happening. Okay, social history. Mr. Johnson is currently homeless. Arzu, that's fine as well, but what I'm trying to emphasize here is that we are using a present tense. So if you use Miss Jackson smokes 20 cigarettes a day, the smoking is still happening. That's why it's in the present tense. The mistake would be, that's why we're going back to what Diksha said at the start. What form of tense are we using? You can use any form of the tense as long as it is in the present tense. No, Kares, that is incorrect. Okay. Why? Because Miss Jackson is still smoking. She's not an ex-smoker. Okay. So the thing is still happening. Okay. Now, that being said, Kares, if Miss Jackson was indeed an ex-smoker, so still smoking means that she is still smoking, so she is still doing the act of smoking. If she was indeed an ex-smoker, when you're writing the letter, she would still be an ex-smoker. So that's why you're going to be using the present tense, because her being an ex-smoker is true when you're writing your letter. Okay. So the term for that is teetotaler. Okay. Or just Simran, you can write he does not smoke, nor does he consume alcohol. So that's a good way that you can write this. Yes, correct, definitely. When someone is smoking in the past and they've quit smoking, they become an ex-smoker. Okay. When you're writing the letter, they are still an ex-smoker. So they are still an ex-smoker. Therefore, I'm using a present tense. So I'm going to write it in the form of a present tense. So he is an ex-smoker. Whereas if you would write he was an ex-smoker, okay, that's going to be incorrect, because what that means is that when you're writing the letter, the being ex-smoker is now in the past, so something has changed. Okay, so then your meaning becomes totally different. So for things which are true at the time that you're writing the letter, they're going to be in present tense. So like we talked about the presenting complaint was true when you were writing the letter. That's why they're all in the present tense. He has back pain since the past 20 years. He is smoking since the past 20 years. He is currently living with his grandmom. So everything which is true and which exists when you're writing your letter, they're all going to be in the present tense. So Kares, if you've understood why, if you write he was an ex-smoker is wrong and why he is an ex-smoker is right, please type in yes, because this is a concept that I really want to drill into everyone today as to what type of tense is important at each point and how that changes the meaning of your letter. Okay, and these are all mistakes which are very, very easy to do. So hopefully no one makes these silly mistakes in tenses again. Okay. So Dr. Monica, what's the question that you have? And I'll try and explain it. Now, one exception that people do struggle with is that if somebody's symptoms have improved or deteriorating, then you're supposed to prefix that with a has or a have. Okay. This was covered by Manu sir in our previous sessions. If you go to our YouTube channel, you should be able to find it. So when somebody's symptoms have changed, you use have or had. So the symptoms, notice the way that I'm saying it. His symptoms have changed. Okay. With regular use of paracetamol, Miss Baxter's pain score has improved. Despite thrice-a-day carers, Mr. Jonas has not been able to manage at home. So, with something, something has not improved. With something, something has improved. Okay. This has been explained in our previous session, so please go to our YouTube channel. Otherwise, make your life easy. Take a screenshot of this. Whenever you're talking about an improvement or a deterioration, just prefix that with a has or a have. So, Dr. Monica, ex-smoker is a characteristic that you have, okay? So, if somebody smokes and they quit smoking, then they're called a ex-smoker, okay? And Dr. Monica, please don't use come again because it's a very informal way. Don't use it on your speaking. Just a side note, okay? If somebody loses that characteristic of being an ex-smoker, then that ex-smoker characteristic becomes in the past. Okay, let's just think. For example, let's make our life easy. Somebody is a ex-criminal, okay, and then somebody is a criminal, then they stop being a criminal and they become an ex-criminal, okay, and they are still an ex-criminal, so they're still not committing crime when you're writing the letter. So in that case, he is an ex-criminal, okay. Now something happens and they become a criminal again, okay. So him being an ex-criminal is something that happened in the past, because now he's not a ex-criminal anymore. He's a criminal now, okay. So if I was writing that letter, him being an ex-criminal would be in the past. So that's why he was an ex-criminal, okay. So if he was an ex-criminal, that means that that was something in the past, something has changed now. He is no longer a ex-criminal, okay. So that is the difference. So just Simran, that's also correct, but this is also correct. All right. If somebody is getting confused, if this is your crutch, just Simran, if you're confident with the sentence that you want to use, you can, okay? I'm not saying that you're incorrect. But if you're not confident and you forget in the exam, then you can use this sentence as well. Okay. Right. When you're summarizing a hospital admission, the hospital admission and its summary happened in the past, okay? So we're all using the past tense, okay? During the course of this admission, okay, notice that when we're talking about the course, we're using the term during. So during the course of this admission, Mr. Smith was managed conservatively. He was started on metformin. Whatever things happened during the admission, everything is in the past tense. If something needs continuation, then like we did in our introductory sentence, we write would need continuation, would benefit from your opinion, because the benefit will happen in the future. That's why we're using would need, okay. He also underwent regular dressings for a diabetic foot infection. All right, so the dressings happened in the past when the hospital admission was ongoing. So that's why we're using the past tense. An exception here, and something which confuses a lot of students. The infection is now resolving, okay? So when you're writing the letter, the infection is improving. So the improvement is happening continuously while you're writing that letter. So how do you write it? You write it in the present continuous tense. The infection is now resolving. Just Simran, because you have that doubt, if I wrote the infection is now resolved, that's going to mean a different thing compared to the infection is now resolving. Can anyone tell me how is that different? If I write the infection is now resolving versus I write the infection is now resolved. How are those two sentences? How do they have two different meanings? If someone can type into the chat window. Okay, so just Simran, you're correct. Is now resolving means that the infection is still there, okay, but it's improving. So something is happening to that infection. The infection is now resolved means that the infection has stopped. So Susan, that's also correct. So treatment is complete. So Susan, treatment would be complete when you would say the infection is now resolved. So now your audience doesn't need to think about the infection anymore because the infection has stopped. The infection is now resolving means that the infection is improving, but maybe your audience would need to keep that in their mind. Yeah, so you're correct. Excellent. So, very important that we medically pay attention to what we're talking about on our OET writing. So, guys, the point of this lecture was that the OET writing is essentially easy. Okay. If you think about things medically and you use your medical brain and you think about what is happening to your patient, what has the patient come in with, what has happened to them while they've been with you, you should be able to yourself logically find out what tense you're supposed to use. The reason why lots of excellent doctors and nurses fail the OET is because nobody uses their language. It's a lot of English and it's a lot of complicated things, which, for example, if even I was reading something and I was reading, for example, a very complex book, for no offense, but if I was reading the Harrison and I didn't understand something and I thought that, oh my God, this is maybe a little bit too complicated for me, perhaps I would have given up on medicine. Okay? But when people explain things or your lecturer explains things to you, which are in a language that you understand, then that makes your life very easy. So try and treat OET writing as your daily job. You're doing your job. You know what's happening to your patient. You know what's happened to your patient in the past. You know what's happening to their infection now. So because you know what's going on, you'll use the correct tense at each point. Okay. Now we've talked about this before, is that when you're concluding your letter, the help has not happened. You're writing the letter, but your expert hasn't started helping your patient yet. So that's why we're going to be using would. So your continued care with regards to this pleasant gentleman would be appreciated. He hasn't started caring for your patient yet, but when this happens in the future, that would be appreciated. Okay, your help pertaining to the care of this pleasant gentleman would be extremely appreciated, and we would be very grateful for the same. So, Arzu, what you would write is an easy way to write about surgery, guys, is he underwent cholecystectomy in 2011. Arzu, make your life easy. Don't use has, had when you don't have to. So you can write he underwent a cholecystectomy in 2011. So if the surgery has happened during this day, you're going to write, during the course of this hospital admission, Mr. Johnson underwent a cholecystectomy. Okay, so underwent cholecystectomy, simple tenses, simple past, make your life easy, make the OET easy, and just write underwent and you're sorted. Because what happens is when you start using has had, have had, lots of students start making mistakes. Okay, and you don't want to make the mistakes, you don't want to expose your weaknesses to your examiner, so just underwent is fine. Yes, in both ways you can write underwent. Okay, excellent. Now, when you're talking about somebody's discharge, now that Arzu has mentioned something which happened in the past and something which happened during the course of the hospital stay, this is a good segue to talk about discharge. Mr. King is being discharged today. So the discharge is happening when you're writing the letter. Okay, so that's why you're using is being. Okay, when you're writing your letter, the discharge is happening. So is being discharged. Okay, if the discharge happened in the past, on 29th October 2019, Mr. Johnson was discharged. Okay, so is being discharged is because the discharge is happening when you're writing the letter. Was discharged is because the discharge has already happened, so it's in the past tense. So just Simran, that would be a lady. So thank you for seeing Mrs. Jones, a 43-year-old lady who has come into the hospital with complaints suggestive of acute appendicitis. Correct, you can write that the medication list will be attached, but that's a bit lazy because remember, when you're writing about medications, you're showing the OET examiners a lot of things. One thing that you're showing them is that you're able to differentiate between which medications are to be put in capital letters and which are to be put in small letters. You're expanding BD into twice a day and TDS into thrice a day, and you're using commas. So if you're writing to a GP and the patient has been admitted to a hospital, then I would explain all of the medications, because it's important for the GP to know what medications you've started for their patient. And Karez, if you still want to write the medication list will be attached, a better way or a more polite way of writing that is the medication list would be attached with this letter. Okay. But guys, I've seen a lot of students do this now, is that they've started writing will a medication list will be attached. What I would suggest is that if you're writing to someone who is definitely going to have to take urgent care of the patient, or you're writing to a GP, medications become extremely, extremely important. So do mention your medications on the OET writing, because I mean, if this was your daily life and you are discharging a patient to your GP, or you are someone who's transferring your patient across to someone, and you're supposed to tell them what has happened to your patient. If you don't mention the medications, that's just annoying, or just being an annoying doctor or nurse. Okay, so tell them about the medications that you've done, because they need to know, because they need to follow through with these medications. They're the people who are going to be taking care of your patient. And when you're taking care of your patient, I think it's very logical that they do need to know about the medications. Okay, so contrary to what anyone tells you, if you're working under me or you're working with me, and if you don't tell me the medication list for a patient, I'll get very annoyed with you. So please don't do that on your OET. Okay, all right. So that was the end of our session. I hope everyone's taken a little bit back from this session. I think it's very important that you concentrate on the meaning of why you're writing a letter and what's happening to your actual patient when you're writing the letter. So hopefully I've dumbed down tenses or made tenses a bit more logical to you as to what you're going to be doing at different points of your letter. So Arzu, good question. When we're mentioning medications, if the medications are still happening to the patient, let me just ask you that question, Arzu. If the patient is still on those medications, what tense would be used? So the medications still exist when you're writing the letter, then the tense that you have to use is the present tense. So Susan and Arzu, you answered your question yourself. Miss X is on metformin. That being said, we talked about when we're talking about an improvement or a deterioration or a change in a patient's status, then it might be useful. So with medications, the three things can happen to the medication, okay? One is that the medication has not changed, okay? The patient was on a medication and they're still on a medication when you're writing the letter. In that case, you're going to write Miss X is on metformin. If the medication has been stopped and while you were dealing with the patient, so there's been a change in your patient's status. So in that case, you're going to be writing Miss X, or you can write the metformin for Miss X has been stopped. Okay, so if you have done that change, then you're going to be writing has been stopped. Okay, or you can write Miss Jones on admission. Miss Jones was on metformin because the metformin was in the past, but that was stopped due to lactic acidosis. Okay, so she was on metformin, which was stopped due to lactic acidosis. Or you can say if something else has happened to the metformin, for example, the patient was on metformin, you stopped the metformin, then you restarted the metformin. Then in that case, you're going to be writing, like Salma said, on admission, Miss Jones was on metformin, which was held due to lactic acidosis. This was restarted and currently she is still on metformin. Okay, so what I'll do is we're going to be holding a special session just on medications because I wanted to cover small and capital letters on medications and writing about commas and writing about the duration of medications. So we're going to be covering this in further detail next week as well. Jocelyn, that's also fine. He takes metformin for his diabetes. Okay, so because he is still taking the metformin when we're writing the letter, so that's why we're going to be using the present tense. Just Simran, so that's a good question. So the suggested word limit on the OET is 180 to 200 words. If you exceed it, then it's highly predicted that you're adding on information which is not relevant to your patient. Okay, on the OET, it's about grammar as well as including the information which is important to your audience. So if you go to our lecture on our YouTube channel, then you should be able to figure out what audience awareness means. But I think it's quite important that you understand audience awareness before attempting any of our practice sessions as well, because you're supposed to select information which is important to your audience and exclude the information which is not important. And if you do that, Jasimran, you should be able to finish your letter in about 180 to 200 words. Okay. So what you can write, Arzu, is that Miss Jones was prescribed oral contraceptive pills in the past, but she has stopped taking the same, because her stopping the OCPs is correct when you're writing the letter. So she has stopped OCPs. Okay. But because the prescription of the OCPs happened in the past, then you're going to be writing she was taking oral contraceptive pills in the past, or she was on oral contraceptive pills in the past. Arzu, never use the term OCP on your exam. Use, if you know the full form, use the full form. Okay. Just Simran, if you want to order 2 writing checks, you'll have to order them separately. Um, what we usually suggest people to do is either get a baseline check of 1, get the score that you're having. If you're passing, then it's fine. But what works for students is that if they order a bulk of 5 writing checks and we're able to work on your grammar topics one by one, or your content one by one, it helps build up your score. And most of our students, they do opt for the bundle of 5, because one, it's a discounted price, and the second is that we can actually see progress from a C grade to a B grade, because that's the way that we move. We move slowly. We work on your sentence structure, we work on your tenses, then we work on your content, then we work on making your sentences nice. So if you order a bulk of 5, you should be able to see that progression yourself. Okay. So guys, if you want to enroll in our writing or speaking sessions, the name of the website is on the screen. One thing that I would strongly suggest is that rather than ordering your writing check immediately 1 week before your exam, I would suggest that you take them at least 2-3 weeks before. If, for example, if we think that you need a lot more time, then we do suggest that we don't give you we give you a very realistic view of what your exam is going to be like. And if your exam is in the next week, people get extremely nervous when they get a failing grade. So if you want to apply for a writing check or a speaking sessions, do opt for them now rather than waiting for the last minute. So Rafia, if you're talking about medication being increased or decreased, you're going to be writing during the course of hospital admission, her blood pressure medications have been increased. So Rafia, we did cover this. When we're talking about an improvement or a deterioration in a status, then we're going to be using has increased or have been increased or has been decreased due to low blood pressure. Okay. All right. So that was the end of the session today. Guys, I hope you've learned something new from this session, and hopefully we're not going to make that mistake again on our OET writing. So I'm going to wrap up now. Please do visit our YouTube channel because it's got a lot of sessions which can be quite useful for you. And hopefully you should be able to do very well on your exam. So I wish you guys all the good luck, and I hope you have a very, very useful and a happy Sunday. And for everyone around, just keep safe, keep studying for your OET. If your exam is getting postponed, don't worry about it. Take it as a time to practice a little bit more, increase your score a little bit more, and hopefully I'll see a lot of you joining us in the NHS very, very soon. Good luck and just take care.